What's so great about Stephen is he cares about everybody.
He has touched the lives of so many people in this city.
He is an ambassador for kids across Louisiana.
He's an amazing human being and an incredible leader.
And he really loves all the things he's involved with, which is a huge gamut.
When I joined the medical staff and then the Board of Trustees of Children's Hospital over 40 years ago, Children's Hospital was fairly new as a full-service children's hospital. I've loved my service here, working with men and women with a vision for providing the very best care to the very most children we can and finding a way to do that.
I've worked alongside Dr. Hales for almost my entire career. He's a trusted friend. He's a person I would call and say, let's go grab an old fashioned. I need to talk to you about work, about Children's Hospital, about Turo, about LCMC Health. Stephen's biggest impact by far to this community is his care for kids. Whether he was directly caring for them as a primary care physician or he was caring for them indirectly through his leadership of Children's Hospital and LCMC Health.
I started as a colleague of Dr. Hales in 1998. I moved to New Orleans and had a baby, and everybody told me I should go to Hales Pediatrics for my care. I never met anybody like him, and when I got to New Orleans and spent just those first couple of months as my pediatrician first, you just felt safe with him. You knew that you were in good hands and good care, and he was able to sort of bring calm to a scenario that wasn't always so calm as a new mother. And so I think most families feel that way. He just has a really nice manner about him that there's just no one like him.
For me, he's been a mentor who's always been available. And I've just cherished that time because I've learned so much from him. I have a standing coffee meeting with Dr. Hales every month, and we talk not about work, but we talk about our families, we talk about the kids, and then we get into things that are going on in the hospital. And it's always still just about, are we doing the right things for kids? What is it that I can do to help Lou? And that's just Dr. Hales.
He's a natural encourager. I certainly got text messages at the right moment that gave me encouragement. But he would come in about an hour before board meetings just to walk around campus and say hello to people. He always loved to find Ronnie, our gardener, and he would stand and talk with Ronnie. How the oak tree's doing? How's the campus doing? He cared about every part of Children's Hospital, from the campus to the care of the patients to leadership. And I think his ability to impact people, to encourage them and make them feel special is amazing.
He is kind and social and loves talking to people and terribly dutiful. He never drops anything or any ball. He never skips a meeting. He could not have been a solo practice doctor without this hospital. I mean, he always knew he had just this huge team of specialists to take care of all of his children.
Children's Hospital, I've always described as a gleam in the eye kind of place. You know, what is this going to look like? Children's Hospital's founders had that gleam. They saw possibilities here, and even though they started with a single floor and not that many beds, I think we've always seen the needs in this community, in this region, and we've tried to meet those. That means building buildings. I don't remember a time that Children's Hospital didn't have a building project underway. We've added to, we've remodeled, we've reused, but we always dreamed of a facility like this. I've been part of so many strategic planning committees and building committees, and this is the facility I always dreamed of. To put $300 million into establishing facilities that really match the quality of the care we give here has just been monumental. This is transformational. It's not just about buildings. When we build, it's to provide more care to more children and better care. And that's what we're doing here. When I walk into this building now, and I remember what it was like when I first walked into Children's Hospital, I just can't help but smile. I mean, this place is transformational physically, it's transformational in terms of the care we provide. And if I'm happy, I can only imagine what Children's Hospital's founders would feel like if they could see this now.
Stephen, thank you for your 42 years of service.
I'd just like to thank you, Stephen, for providing an amazing place for me to work, for taking care of my children, both of whom were not always easy and straightforward, and continuing our friendship over time.
Thank you, Dr. Hales, for having high expectations of us. I appreciate you.
But most of all, thank you for always being available and present. Whether they're small events, big, you're always there. I can always count on you, and that means a lot.
Thank you, dearie, for letting me be part of Children's Hospital, too.
And Dr. Hales, one last thing.
Who dat?
You dat!